Hi and welcome to Walsall Maternity Unit. It is our intention today through this DVD to let you know about the excellent facilities we have at Walsall for maternity care, introduce you to some key people who are here to help you and give you some valuable information about what to expect during your pregnancy journey. We are a team of kind, caring and professional staff who want the best possible patient experience for our women and families of Walsall and other women who choose to use our services. We currently deliver 4,000 women a year and all our services are now under one roof, easily accessible to each other.
I think the difference here at Walsall Healthcare NHS Trust is that we are one integrated team providing you and your family with a whole range of services from one organisation. My team are excellent, very professional, nothing is too much trouble, and we have a whole range of facilities on offer for our patients and our staff.
The range of maternity services that Walsall Maternity Unit offer are provided from several different locations. Out in the community, in Women's Services Outpatients, which is situated in the new part of the hospital. The Early Pregnancy Assessment Unit, Maternity Triage, Delivery Suite and our inpatient wards are all in the modernised, well-established maternity building that opened in 1994. We are currently delivering around 4,000 women a year here in Walsall. We are offering a great range of maternity services. They are designed to be accessible, flexible and convenient for the women and families that use them, and that is why so many women choose Walsall to have their baby. A home birth service is available for those women who are suitable. You should speak to your midwife if you are considering or wish to have a home birth.
Today to deliver a home delivery box to the lady that's planned a home birth. She's a low risk lady and it's nice that she's got the choice here in Walsall.
I've met this lady Sue, she's a lovely lady. She's had babies before but always planned to have her babies in the hospital. Now she's got the choice, which she had before but didn't take the option of having her baby at home.
For women who have had a previous pregnancy with no problems or a low risk uncomplicated current pregnancy, the Midwifery-led birthing unit may be an option you choose, as it will provide an alternative facility in which to have your baby.
These women who do not have any problems in pregnancy and who have had normal deliveries before will be looked after mainly by midwives in this unit. However, should a problem develop during their labour and should they need a doctor, then access to this doctor is available within minutes of the problem developing. Should a caesarean section delivery or any other delivery which is not normal be necessary, then this will be offered to these women without any problems or complications.
The hospital has a direct bus link that drops you off right outside the building. There are also plenty of pick-up and drop-off points situated across the site. There are several car parking facilities across the hospital site and these car parks are pay on foot. There are several ways to enter the building. There is the main Pleck Road entrance through the large revolving doors which is opposite car park P and may be suitable for you to use when walking a short distance. This entrance greets you with the Trust Spa shop, so that any light refreshments can be purchased from here as you enter the building. There is the inpatient entrance close to car park D, which will bring you into the main corridor that leads to Women's Services Outpatients. You will see the original Sister Dora statue to your right when you walk into the building via this route. And if you carry on walking down the corridor, you will come to Costa Coffee.
And my mum was really happy with the facilities because she had to spend so much time here with me. My husband chose not to take his paternity leave until I actually came home. So my mum came in every single day and she was here all day. So she used the restaurant facilities and Costa Coffee and could go and get a magazine from the shop here, those sorts of things. Whatever she needed, she found it was on site, which was really good. And it meant that my stay was comfortable because it meant my mum could stay here as long with me as she needed to and wanted to.
We're having a nice drink at the moment. It's beautiful coffee, and we're helping them when Vicky goes back because things are starting to move along.
Even if not, come back down here this afternoon.
Yes.
And we've got the shop as well to look
Oh
at.
yes, there's a beautiful little nice new parents shop down there, and we're going to have a browse around there when we finished our nice cup of coffee. The staff are wonderful, absolutely wonderful.
And what did you do when you came here to the hospital?
Good.
It was good. And what did you do while you were waiting for Mummy?
Went on the train.
You went on the train. And who was there?
More children.
Really?
Yes.
And what colour was that train?
Red.
Yeah. The whole experience here was really good.
It was a good distraction, especially if Mum's at appointments. They can come and play while she can go off and do an appointment without them whinging and crying because they're bored just sitting about and waiting.
Here at Walsall Hospital we have some excellent facilities for families and visitors. We have the Taste Cafe, Costa Coffee and the Spa Shop. Whilst mums are inpatients, we do offer excellent catering services on the ward. We have a focus group which constantly monitors the feedback which we receive from mums, and we act upon any feedback straight away, and I can say confidently that the patient food here is excellent.
The emergency entrance is for you to use when you arrive in labour or when there is concern about you or your baby. This takes you directly to the delivery suite and the maternity triage department. When you are in labour, your partner or birthing partner will be advised to use the blue light entrance. This has several free car parking bays and can be used to drop you off and pick you up. In the event of an emergency, please use the emergency entrance. It has its own separate road and it is also the ambulance route. If you stay with us for longer than a day, it may be best to purchase a week's car parking pass. Please ask your delivery suite midwife for information about this.
At your first visit to the antenatal clinic in the community, you'll see your community midwife. She'll give you a lot of information and a lot of documentation. The first thing will be your pregnancy notes. These you'll carry around with you all the time, because if you have to leave the area, go to a different hospital, they'll want to see them.
Please follow the pink signs for Women's Services outpatients to find our antenatal clinic where you are seen following your first assessment by your community midwife. You may attend the antenatal clinic for a scan, screening, or for any ongoing concerns or monitoring required relating to your health or your pregnancy. When your midwife first sees you in your pregnancy, she'll perform an assessment of your health and pregnancy history, and this will assist her to plan your pregnancy care with you. With a good pregnancy history and an uneventful current pregnancy, you will receive midwifery-led care. Lots of information leaflets and books are issued to you during your antenatal and postnatal period. This will support the information you are given by the health professionals. Midwives and medical staff will be able to give you advice around diet and nutrition, mental health, drug and alcohol use, the options available for mums who are teenagers, advice about weight management, and advice about giving up smoking. We also give financial advice and other support that can be found through organisations like Connections.
On the gynaecology ward, we do have an early pregnancy assessment unit. The staff nurse running that unit is very competent, she's very caring, she's always willing to help should you have any problems in early pregnancy. We're a very welcoming and warm team. Should you need our help, we're there for you.
Women with any risk factors will be cared for by a team of professionals and will be consultant-led. It is important to remember that women can change between care pathways as pregnancy progresses. Several screening tests are available in the first part of your pregnancy. Your community midwife will be able to give you more information about these tests. Here in the antenatal clinic is where your ultrasound scan will take place.
Throughout a normal pregnancy, a lady may expect to have at least 2 scans offered to her. The first scan is usually offered at about 13 weeks gestation, and that's predominantly to date the baby and to decide an expected date of delivery, which is a really important day. The second scan is usually performed at about 20 weeks and is a more detailed scan. And throughout both scans, the scans normally take about 20 minutes. Over the course of a pregnancy, a decision may be taken to do additional scans, and that depends on a number of factors decided by the obstetrician. And predominantly, if you are having a twin pregnancy, your scan time will likely to be double. You could expect a longer scan time so that we can assess both babies fully.
Reflexology clinics are provided to help women who have gone overdue. This service has been recognised for a Good Practice Award by the Royal College of Midwives. The service aims to start labour off naturally. We have a fantastic new hospital with new and exciting services that we can offer you while you're pregnant, during your labour and after you've had your baby. We have a team of highly skilled, kind and professional people who really want to look after you and make your stay with us enjoyable. There is a supervisor of midwives available 7 days a week, 365 days a year. The Supervisors of Midwives office is based in the Antenatal clinic. Their role is very important to you as mums and dads and the midwives here, as they ensure that all the midwives are practising safely and protect you and your baby.
Within Walsall, we have a 24-hour on-call service so that women have access to a supervisor of midwives at all times. Our role is to ensure that the women have the service they want and that if there's any problems they can access at all times. We're here also to ensure that the midwives keep up their skills and their abilities so they offer a good quality service.
To make your hospital stay as comfortable as possible, your midwife will brief you on what items you need to bring into hospital. Just bring enough clothes for you and your baby for 24 hours, some nappies and any other items your midwife advises that you will need. If you think you're in labour or you have any concerns about the onset of labour, you should give us a call on our direct number 01922 65 6283 before leaving the house. There is easy access to the delivery suite using these double doors. This is the quickest way to come in or when you have appointments or are in labour.
Staff on the maternity unit understand that it's okay for families and prospective mothers to challenge them about hand washing so that families and prospective mothers can see that staff are washing their hands within sight of them or using the alcohol gels. We would of course also encourage all visitors when they are visiting prospective mothers and when they come to visit new babies that they too use the gels when they come to visit the ward areas.
To prevent cross-infection, it is paramount that whoever enters the delivery suite uses the hand gel provided before entering. Please ask your relatives to do the same on entry and when leaving all ward areas. You must always press the button by the hand gel dispenser before entering delivery suite and wait for a clerk or midwife to answer. The staff will give access to you and your relatives once they have had the opportunity to check who it is via the closed circuit TV monitor and then let you in. If you are not in established labour when you arrive, you will often be placed into a ward area where midwives can monitor your progress. This might be in the maternity triage, which is at the entrance of the delivery suite, through the left-hand doors, or the 4-bedded monitoring bay on the delivery suite, which is through the right-hand doors. If you are not in labour following assessment, you may return home. If you have been assessed as low risk both throughout your pregnancy and on admission to the delivery suite, you will be allocated a named midwife to lead in your care.
We also look after ladies who have more complex, high-risk pregnancies, who need more input from the midwives and the medical staff. And we look after them all depending on whether they stay on delivery suite or move to the postnatal wards when they've had their babies, or even go straight home from delivery suite.
If you or your baby have any specific medical needs, you will be transferred to consultant-led care or on a combined plan, and will see a doctor during labour. However, you will still be mainly cared for by the midwives.
I worked as a team when I was a junior doctor and have come back to work on the maternity unit here because of the excellent care that we provide to patients, the continuity of care that we provide to patients.
We want mums here at Walsall to really have a good patient experience, right from first contact when she finds out she's pregnant, to the care where we give when we discharge her care, to her health visit out in community and when she's had her baby. We want mums to let us know about the care that they're receiving is of a good quality. And if it's not, where we can make improvements. And we're really open to that kind of feedback from mums, that we need to get our service the best we can give. We give an excellent service to mums, but there's always, as we know, room for improvement. And that's really the kind of feedback we need back from mums to help us do that for people who are going to follow the journey after that mum.
The midwife station is situated in the middle of the delivery suite and is a central point in the ward for patients and staff who are constantly monitoring your care.
One of the main attractions of this hospital for us to work is the group of midwives that we have. They are the biggest asset for this institution, and they actually give 100% to the job that they do, and gives us great pleasure to work as a team.
We have a fantastic team here at Walsall, and each member of that team can provide something individually, so that whatever the woman's needs and the needs of her family, it can be catered for, so anyone can book at Walsall and find that they get a good experience.
It is great, isn't it? Because we have 8 midwives on shift at any given time. We have the health cares, we have the clinical support, we have the housekeeping support, and we'll all interact with each other to give support and care for the patients that we have here at Walsall, both the women and their families, and they'll have a fantastic experience, we hope. Childbirth is a frightening experience when they first come in, but we hope to make it a positive one for the whole family.
Here we are in Walsall Hospital's delivery suite, the start of the journey to have your baby. Once you are in labour, you will be taken into your own delivery room. We have 9 dedicated delivery rooms with en-suite facilities. All the rooms are very similar, and everything you need for your delivery will be in here. As you can see, there is a bed which will go up and down and into a sitting position. There is a chair for your partner or your birthing partner so that they can be with you to comfort and support you. As mentioned previously, you will have your midwife with you throughout the experience. But when it looks like your baby is ready to arrive, a second midwife will join you. Please do not be alarmed by the presence of more people, as this is standard practice and helps to ensure that you and your baby get the level of care you require. During low-risk labour, there is a range of equipment available that you can use to encourage active birth. This includes several birthing pools where you can experience a water birth. The pools are a great option for delivery for low-risk women. This is a lovely bath with water temperature that is regulated and constantly checked. It's one of the best forms of pain relief. So if you want a natural birth, it is an absolutely wonderful option. Babies will often be born in a relaxed and calm way. If you wish to have labour in the pool, please discuss this with your community midwife or your delivery suite midwife on admission. But please note, the pools are only designed for labouring women.
Here at Walsall Hospital, everybody has their own birthing room, and we have lots of facilities that we can help you through your labour.
Should you wish to play music during your labour, we are happy to support you to do this. Some mums find this very soothing. You may wish to bring in your own music players, and please note that these must be powered by batteries, and the safety of these items remain your responsibility. We have 2 theatres on the delivery suite for any woman requiring delivery by caesarean section. If you are having a planned caesarean section, this is where you will have your baby. The majority of caesarean sections are performed under a spinal anaesthetic. This type of procedure allows you to have your caesarean section pain-free whilst remaining awake. Partners are most welcome to support you in the operating theatre if you have a spinal anaesthetic. The midwife will monitor your blood pressure and pulse regularly while you are in labour. She will also monitor how well any pain relief you have used is working. There are lots of methods of pain relief you may choose from. Antenatal, commonly known as gas and air, is piped into all rooms on the delivery suite. You may choose water through the use of the jacuzzis, TENS machines or pethidine injections. The hospital also provides a 24-hour epidural service. For more information on your pain relief, please discuss this with your midwife.
When a mum arrives on our delivery suite in labour, we've got numerous pain relief choices for her. So we kind of discuss with her what her needs are and what her choices are for pain relief.
The call buttons, which are pinned to the side of the bed, will enable you to call the midwife at any time if she needs to leave your room. You can bring in your own bottled water if you prefer. However, iced water is available on the delivery suite. We advise you to bring with you an old nightshirt or t-shirt to wear in labour, and a lip salve or Vaseline is useful in labour to keep your lips moist. You are allowed to have 2 birthing partners who can keep the rest of the family informed of your progress. This will reduce the amount of calls to the delivery suite so that the staff can concentrate on delivering safe and efficient care to you and the other women on the ward. At one time, mobile phones were not allowed in the clinical areas because of interference with equipment. But now there is no reason why you should not use a mobile phone. We just ask that you consider the people working and delivering their babies in the environment and go to a space outside of the actual ward area to make your calls. All of our midwives are highly trained, and should you require specialist medical support, we have a dedicated team of consultant obstetricians, consultant anaesthetists and their associated colleagues who provide 24-hour cover. Following the birth of your baby, it is essential to dry your baby and keep the baby warm. Please remember to bring a newborn-sized hat into hospital for your baby to wear. The baby's head is where most heat is lost from following delivery. We will then place the baby on your tummy to keep the baby warm and feeling secure. This is called skin-to-skin contact. to get in contact with your baby is very important following delivery. It keeps the baby warm, regulates the heartbeat and breathing, and helps to initiate breastfeeding. If your baby needs attention to help establish breathing, then the midwife will place the baby on the resuscitator. She may clear the baby's airway and give the baby some oxygen. This is quite normal following delivery, and she will return the baby to you as soon as possible. When your baby is born, a baby tag will be placed on your baby's ankle. This is a security tag and will make an audible alarm sound if your baby is moved to an area that is not permitted. A smaller handwritten band will also be placed on your baby's other ankle. Please ensure that the tags are not removed until you and your baby are discharged from hospital.
In relation to maternity, we also have a state-of-the-art baby tagging system, extensive CCTV, which is monitored 24 hours a day, 7 days a week. I have a team of guards who patrol the corridors and car parks. We're available should we need to be called. In relation to maternity, actually, I get none. This, for mums and dads, is very reassuring.
Very good security they've got here with the babies, if there's any. Because apparently if whichever entrance you get out, somebody's trying to shut the whole hospital down.
Following delivery of your baby, the midwife will perform a thorough check of yourself and baby. You will be offered refreshments, a shower or wash, and a change of clothes. You will then be given some private time alone with your partner and baby. But remember, you can always call the midwife should you need her. The following times are guidelines and will depend on how you and the baby are doing following delivery. You will need time to recover from the birth and make sure that the baby is feeding well before we send you home into the care of the community midwife. If you have a normal delivery without any complications, then you should plan to return home between 2 to 6 hours after the birth. If you have an instrumental delivery, such as a forceps or a ventouse, then plan for a 24-hour stay. If you have a caesarean section birth, either planned or an emergency, your stay will be around 48 hours. It is quite a journey for some babies to enter the world. Some babies are born a little shocked, and some babies decide to arrive earlier than expected. If this is the case for your baby, then we have excellent facilities in our neonatal unit, where your baby will receive exactly the right care by a team of experts.
You've got a great team of staff on the neonatal unit. We all work really hard together, don't we, Susie?
Yeah, we've got sisters, staff nurses, nursery nurses, and then obviously we've got all of the doctors, the physios, dietitians, a big multidisciplinary team. It's lovely working so closely with the families and interacting with them and seeing the babies go from being very, very poorly to getting bigger and hopefully well enough to go home. We have lots of thank you cards and the parents bringing the babies back, and it's wonderful to see them develop and become young people and children that are hopefully well.
Visiting on the neonatal unit is understandably very controlled. These babies need extra special protection from any external infections. We encourage parents, grandparents and your own children to visit, as long as they do not have an infection or have been in contact with any infectious people. This could mean a simple cough or cold, or more serious infections such as measles or chickenpox in the case of children. If you do not return home from the delivery suite, then you will be transferred to the postnatal wards.
One of the areas that I'm responsible for are the maternity inpatient wards. That's Foxglove, which is Ward 24, and Primrose, which is Ward 25. Foxglove Ward, we tend to have the mums that have had caesarean section, and Primrose Ward, everybody else. A lot of mums go home straight from delivery suite, but if not, then they'll be up with us on Ward 25 for an overnight stay. We have all the equipment and the staff that's needed to look after them, so if there's anything that they need, they've only got to ask.
On the postnatal wards, visiting is between 10 AM in the morning until 8:30 in the evening for your birthing partner. All other family and friends may visit in the afternoons between 3 and 4 and evenings between 6:30 and 8 p.m. No children under the age of 12 other than your own are allowed to visit. This is to reduce the risk of infection. We try to protect your meal times so that you can enjoy some peace.
Can't thank the staff enough for what they've done for us. Really can't.
I recommend it, definitely recommend it to other people. Definitely. I mean, they've looked after my wife. They've been nice to my children. Car parking facilities are great as well. I mean, they've given me a pass for the week. I paid the first time, they give me a pass for the complete week. So I'm happy with that as well.
And it's just, as thank for them, a year to the day of the 22nd next year, I shall come back in and bring a card like I've done with every single one of my children. They're absolutely fantastic, and I just thought we didn't have to lose so much contact. I wish I could just go up and see them regularly as I could, really.
We do not provide meals for partners, but we have several lovely dining facilities that staff, patients and visitors are welcome to use. If you leave the ward area, please inform the staff and leave a contact number, just in case we need to get in touch with you. The Trust operates a strict no smoking policy. However, there are smoking shelters which you may use. Here is our Café au lait room on the postnatal ward, which is a sitting room that provides a great opportunity for new mums to practice breastfeeding. It's an ideal place to mingle with other mothers on the ward, or somewhere to go just in case you want to get away from your bed. There is plenty of reading material available in here. Our peer support workers often spend time in here with new mums, offering support around breastfeeding. They also work across the community, so if you live in Walsall and you are breastfeeding, they will come and visit you at your home to help establish breastfeeding and help you with any other problems. If you have chosen to bottle feed, we provide sterilised bottles, but you are required to bring your own baby milk to use while you are in hospital. The spa shop does provide baby milk should you forget, and is situated on the lower floor. We are a UNICEF baby-friendly maternity unit. This means that we encourage and provide support to all mothers regardless of the method of feeding you choose. We encourage all babies to stay with their mothers at all times whilst in hospital, unless medical reasons require mums and babies to be separated. This has the added benefit of encouraging and supporting breastfeeding and gets you used to your baby's behaviour, and signals that let you know when baby is hungry, hot or cold, or just wants a cuddle. Before you and your baby are discharged from hospital, your baby will receive a thorough physical examination. This will be a top-to-toe examination which will be carried out by the baby doctor or midwife. Your baby will also receive a hearing test. This may be undertaken in hospital, or you will be given an appointment to attend a clinic in the community at a later date. The results will be documented in your baby's red book, which you will take home with you. If you and your baby are well, you may be discharged as soon as 2 hours, so that you can further recover in the comfort of your own home with your family and friends around. Our comprehensive community service starts from the first time you see your community midwife to your care in the postnatal period following the birth of your baby. There are a wide range of services to support you, your partner and your baby within the community and your home. These include family planning and contraception, postnatal follow-up care through your community midwife, support services through your general practitioner and children's centres. Also available is the opportunity to record your baby's milestones, weights and measurements using your child health record book.
Walsall women get postnatal care usually from their named midwife, and they find that very useful, having a named midwife, because it's a familiar face to them, and like that we've followed them all the way through their pregnancy right up until the end. So it's nice that you're just giving that little bit of aftercare. And once we finish visiting them at home, they can go to a postnatal clinic as well, so there's that extra step for them. You know, we can follow them up, and I think they appreciate the fact that they can get out and still see us in a postnatal clinic.
That's right. And I think also, not just us as midwives, we provide a service in the postnatal section of their care, but also the fact that we can ask for breastfeeding buddies to come over and help them with their breastfeeding, support them also in
maternity support workers can go out for new mums that want help with the breastfeeding or bathing a baby, things like that.
Changing the nappy.
There's lots of support, and we're only a phone call away, and we can get that service up and running.
Because sometimes the first time you're very, it's a fear of the unknown. You're not too sure how to deal with this. You have this baby, you don't know how to deal with the baby, what to do with it. But then we're here to support you and help you to get your confidence and to know what to do, with the baby if they need anything as well.
Here's a phone call. Just ring us up.
Yeah,
we'll sort you out.
We'll sort you out. We're always at the end of the phone, always.
Have a go with your car seat before you come to hospital. Make sure you can fasten baby in easily and safely.
If mum would like to find out information, honest answers from mums who've used the service here in Walsall, they are able to do that by visiting the Care Quality Commission website, which is a national website which asks questions to all mums who've received care and maternity services, and mums will be able to compare our answers to other units in the region.
Now that you have had the opportunity to see our maternity unit and the great care and services we offer, we do hope you choose Walsall Maternity Unit for your maternity care, and join us very soon when you can be sure you will receive a warm and friendly welcome.
I love my job. I love going to work. Seeing a woman holding a baby after seeing her for 9 months and being a part of their happiness, being a part of their family's happiness, it's a great moment. I think Walsall Hospital provide a great service and the staff are lovely and friendly. I wouldn't want to go anywhere else.